Okay, so today we're doing a deep dive into the North Central Regional Health Authority in Trinidad and Tobago, the NCRHA.
Right.
It's actually the newest RHA, set up back in 2004. And it manages some pretty major facilities like the Eric Williams Medical Sciences Complex, the EWMSC.
Hmm.
And our goal here really is to get past just the basics, the institutional facts.
Yeah.
We want to tackle this paradox that seems to define the NCRHA.
Paradox. How so?
Well, on one hand, you see real operational strength, particularly with equipment maintenance, which is kind of impressive.
Okay.
But then at the same time, it looks like it's struggling with some pretty deep internal governance problems, staff relations, financial allegations.
So great with machines, maybe not so great with people or processes.
That's kind of the core tension we need to explore. How can both be true?
All right, let's maybe start with the patient experience then. That feels like the ground level, and it operates within, well, a pretty strained national system, doesn't it? Oh, absolutely. The whole public health system in TNT faces these chronic challenges. Not enough money, maintenance issue.
And the big one, waiting times. Just endless waiting.
Yeah, the data on that is quite stark, actually. One study found 74.2% of people using public health centers
Wow.
spend between 2 and 6 hours there per visit.
2 to 6 hours. That's half your workday gone just waiting.
Pretty much. It really shows the strain on people. And sometimes that strain leads to worse outcomes and legal issues.
Right. The medical negligence cases, we've seen those mentioned.
We have the EWMSC under NCRHA was found at fault for not diagnosing a hip fracture quickly enough in one instance.
Okay.
But, and this is important context, these kinds of claims aren't just an NCRHA problem.
So it's wider.
Yeah, it seems to be systemic. You see similar cases documented against the Southwest RHA, the Northwest RHA. It's a vulnerability across the board, suggesting, maybe broader issues with standards or staffing.
Okay, so the legal challenges show a kind of baseline struggle across the system. But you mentioned a paradox specific to NCRHA. Let's get into that, the operational success part.
Right, this is where it gets really interesting. Despite all the system pressures, NCRHA seems to be, well, a positive outlier when it comes to keeping its medical equipment running.
How good are we talking?
They report a 98% uptime for critical equipment, that's industry-leading stuff.
98%. How?
They put it down to planned preventative maintenance, basically fixing things before they break catastrophically.
And that makes a difference compared to others.
A huge difference, it seems. Well, NCRHA has this high uptime. You hear reports like the SWRHA had 8 or 9 month delays for MRI scans because of equipment issues.
Nuts. Wow.
And the Eastern RHA, the ERHA, didn't even have an MRI machine at the time of these reports.
Okay, so operationally with the machines, they're really delivering in a way others aren't.
Exactly. That's the resilience part.
But if they have the know-how and maybe the funding processes for that, why the other side of the coin, the governance failures you mentioned?
That's the million-dollar question, isn't it? Because this operational success seems completely undermined by what's happening internally.
And what is happening?
Well, we have some pretty serious allegations coming from the Trinidad and Tobago Registered Nurses Association, the TTRNA. They talk about dubious activity, alleged financial mismanagement.
Okay, that sounds serious. What's the core complaint?
The main thing driving really poor morale and trust issues seems to be the non-payment of employee entitlements.
Things like
basic stuff. Increments in pay, gratuity payouts, pensions, the essentials.
And is this just the general funding crunch everyone faces, or?
Well, here's the critical distinction that TTRNA makes. They claim that while, yes, other RHAs might have delays in paying these things, the situation at NCRHA is, or was perceived to be, uniquely severe. Their specific claim was all other RHAs, with some delay, are paying, implying NCRHA wasn't or not consistently.
So that specific failure to pay staff what they're owed, that's what sets NCRHA apart in this negative way, despite the shiny equipment.
Precisely. It suggests this isn't just about the national budget. It points towards, potentially, a very specific, localized governance deficit within the NCRHA itself, and that's destroying staff trust.
So wrapping this up then, the NCRHA's story is complicated. It's caught in the national system's constraints.
Right. The funding issues, the waiting times, those affect everyone.
But it also seems to suffer from its own quite profound internal problems, especially around staff payments and trust, that make its situation unique.
Exactly. It's this mix of systemic pressure and specific internal failure.
Now, thinking about accountability and improving things, our sources highlighted something missing across the entire system, didn't they?
Yes, a really critical point. The apparent lack of transparent, publicly available, centralized data, specifically on things like patient deaths or detailed outcomes. No central registry.
Which leaves us with a final thought for you, the listener.
If an RHA can keep its machines running almost perfectly, but maybe fails its staff fundamentally.
And if nobody publicly is tracking the most critical outcomes, like patient survival across the whole system, in a transparent way,
Then how can we as a public really know how well the system is doing? How do you hold institutions accountable or even measure if things are getting better? Something to consider.